and also about our panelist who is here today. As you all know, today the topic for the webinar is the health and environment connections. So we have expertise here, Dr. Jazla Fada, who is here among us to give our wonderful insight today. So we all know that climate change is the single biggest health threat facing this humanity. And health professionals worldwide are already responding to the health harms caused by this unfolding crisis. On this topic, we have Dr. Jazla Fada here, who is a public health expert and also a prominent healthcare management consultant. She has contributed widely in the healthcare management. She has been a prominent member with Emirates Public Health Association, and she has been a health researcher at MENA College of Management in UAE, Dubai. She has also been a founder of Visionary Mindset, Professional and Management Development Training. And she has been a faculty with Westford University. So I welcome you to the board, Dr. Jazla, today, and we are all waiting for your experts commentary on the topic today. Over to you, Dr. Jazla Fada.
Okay. Thank you so much, Sanjita, for this introduction. And I'd like to welcome all the participants that are following and watching this seminar. Today, our topic will be related to the health environment connection, and basically it's related to the climate change health impacts. And of course, always, whenever we have problems, we need to find the solutions. We all know that climate change is recently, and not only recently, in general, climate change is the main threats of public health on the whole planet. And when we say climate change, let me just have an introduction for that. When we say climate change, okay, we find some areas that were so hot and now it's become cold and so cold and have become hot. So all this climate change, if we think about it, it's a matter only of changing of the temperature, of changing of the sea level, of changing of the rainfall patterns, or we have something else. Climate change, at the end of the day, will affect not only the environmental determinants of health. You know that health, if we want just to start defining health, the word health, health is not merely the absence of disease. It's the complete physical, mental, and social well-being. That means anything, and we call it determinants of health, will affect health directly or indirectly. And we have a wide range of determinants of health: physical, environment, or social, or economic. So climate change, unfortunately, is affecting the environmental determinants of health. We can say the clean water, the clean air, or safe drinking water, even though the food security, and even though social, the shelter security, which also entails, as we will see in the presentation, lots of social consequences that social consequences that will affect ultimately health. And let me give you a quick figure in order just to show you how this will be a threat for our planets. WHO estimates that between 2030 and 2050, the planet, the Earth, will have 250,000 additional deaths per year, each year, okay, 250,000. and those caused by climate change. From what? From chronic diseases, transmitted diseases, or communicable diseases, let's say, and non-communicable diseases, and social aspect. So this will cost a lot. This will cost the governments a lot because you will have more morbidity, more mortality, more burden of disease, and this will cost. And also they estimate that the cost will be between $2 to $4 billion per year by 2030 only. Okay, so that let us stop and think, what are the major impacts of climate change affecting our Earth? Yes. So in this presentation, I would like to highlight on different things to let you really understand how climate change affecting us, how climate change affecting our health. We will have direct impact. So climate change can directly affect our health, and we'll see what are the patterns for that, and can indirectly affect our health as well. Okay. And here it's very important to highlight that climate change also is correlated with many infectious diseases. And I would say here, not only infectious diseases, the re-emerging of infectious diseases, communicable diseases that we have eradicated, or we thought that we eradicated a long time ago, but it's back in another pattern, like the influenza we are witnessing recently. And we will see also how climate extremes will also affect our health and correlate to diseases and list of diseases. Of course, as I introduced you earlier, this will have lots or high burden of disease. And when I say burden of disease, I'm here not only pointing at the cost, the burden cost. No, I'm talking about something called disability adjusted life year, which is related to the mortality and the morbidity. So we will have high morbidity and high mortality. That means people will lose lots of their life or years of life because of the diseases connected and caused by climate change. So we'll not only go into the problems, we need to find solutions. So that's why also we will try together to see, can we mitigate these impacts? Of course we can. And it's everyone's responsibility. So let's get started. According to World Health Organization, climate change, as I mentioned earlier, affecting the social life, environmental life, okay, or environmental determinants of health, like clean air, safe drinking water, and sufficient food. So this will affect the nutrition and secure shelter. And when I say social, we will wonder how socially will be affected. Yes, because when we find or when we have natural disasters and people are dislocated, and for this dislocation, we will find lots of correlated social issues, which violence and another issues, and malnutrition and security, food security, social security. And this is actually the social aspects of climate change. Now, if we look here, extreme weather and climate change. Every summer and every winter, we will look at the news and see there is a heat waves here, and there is a cold wave here, and we find that people are really dying from that, especially some people who are at risk, and we'll see who are they. So this will be represented as weather extremes, let's say. So what are the weather extremes? Extremes, when the weather became extremes, So that means our health, our population are in danger. So what kind of extremes we can expect? We can expect tornadoes, hurricanes, severe droughts, precipitation events, floods, and heat waves. And of course, here we have strong evidence about the correlation between, of course, when we have droughts, we will see what kind of health consequences will entail because of this droughts. When we have precipitation, when we have floods, when we have heat waves, all this will cause lots of impacts on the environment and then on our health. But who are at risk? Who are at risk from climate change? Actually, when we talk about climate change has this impacts that affect basically the environment, okay? So the environment that will be the determinants of our health. But who will be at risk? Of course, those countries which don't have enough infrastructure to contain these environmental changes or environmental threats. So of course we have, and as you can see here, climate change vulnerability index, you can, in this red, you can see that those are the highly impacted countries by climate change. So we can expect those in Central South America, the Middle East, Eastern and Southern Africa. So I'm not saying that climate change is not affecting the whole Earth. It affects the whole Earth, but those are impacted by their effects on population. So those who are in the second, or let's say the northern hemisphere, will be less impacted by climate change impacts. So let's explore from health point of view how this will work out and how climate change will impact our health. Climate change is threatening our health. Okay, how? Simply, you know, in order to live safely, we need first to have our basic needs, according to Maslow's hierarchy of needs, right? So Maslow's needs, or Maslow's hierarchy of needs, put the basic needs in the bottom. So if these needs are impacted, we cannot live safely, and that will affect our health and cause, as I said, morbidity, which is sickness, or mortality, which is death, and that will make the burden of disease higher and higher. So what are the things that will, or related to our basic needs, that will be affected by climate change? So first of all, let's start with the basic needs, the most important. We need to breathe. We need to breathe clean water. So this is the first thing will be impacted. Because why? When we have a climate change, our environment, the air will be polluted, full of pollutants, okay? And this, of course, will affect directly our respiratory system. Okay, water. When we have floods, we will expect that the water we are drinking won't be safe. It will be impacted. And then we will have a problem with the drinking water. So that means our digestive system will be impacted. Food. When we have a drought, for instance, things that affect the agriculture, Not only the agriculture, maybe the supply chain of the food. This also will cause malnutrition and will be also correlated with many diseases. The heat waves. And the most important thing, by the way, is the vector-borne diseases. We have heard about malaria, Zika virus, donkey virus. All these viruses are related or transmitted because of, or it's vector-borne diseases. So we need vectors, insects, in order to get these diseases. But what's the relationship between this and climate change? Yes, because also climate change, the floods, the heat waves, all this will change the pattern that these diseases will be more active and will be with this active life of these vectors will expose our people to those kind of diseases that some of them are fatal. Okay, so let's go further and explore more in details what is the climate change health impacts directly and indirectly. I told you earlier, climate change will affect all the planet. But some regions will be more impacted. We said that that's because the weak infrastructure. But even though in each country impacted by climate change, we have a group at risk. Who are the group at risk? Disadvantaged group. Why? Because those don't have enough infrastructure to protect them. They don't have safe drinking water. They are living in slum areas, which is highly polluted. They are not getting, they are socially and economically, they are isolated. They don't have enough education. They don't have enough, let's say, economic class status, let's say, that will support them to access to the infrastructure or to healthcare or health accessibility and so on. Only those? No. Let's talk about now the age group. Children, elders, pregnant women will be also impacted by the climate change. People with disability, people with chronic diseases, also those will be impacted, and highly vulnerable group, rural community, disadvantaged, remote area, and even though those workers who are spending their time under the sun, and those will be more impacted. Now, how this will affect? Okay, so we said that climate change will do some changes in the environment, and these changes in turn will affect and have the impacts indirectly. So when we have heat waves, storms, floods, droughts, those as consequences, environmental consequences of climate change, we will expect that we will have, this will affect, of course, the storms will affect our air quality, the floods will affect the water quality, the drought will affect our food quality and the quantity as well. And all this also will affect the ecosystems, and that will be reflected or impacted through the changing pattern of the vectors. Okay, now when the air quality is impacted, the water quality, the food quality, the ecosystem, what we will have as, again, consequences, health consequences, we will have problems in or we will have cardiovascular diseases. So our the people will be vulnerable more to those diseases, which is called cardiovascular diseases, CVDs. Not only this, of course, our respiratory system will be impacted. We will expect more allergies. We will expect more infectious diseases, unfortunately, because of the contaminated water, contaminated food, and those vectors. We will have injuries. Storm, floods cause injuries. And because of this, ultimately, we will have some mental disorders and traumas because of the natural disasters, dislocation, and so on. So, directly, how climate change can impact our health? Directly. First of all, weather extremes. And when I say weather extremes, I will say that we will have heat waves, cold waves. So when we have this weather extremes, if we list the general, let's say, consequences or health impacts, of course, as I said earlier, cardiovascular diseases, respiratory disorders, heat stroke, permanent disability sometimes, and because of the air pollutants, we will have more respiratory problems. And of course, infants, old people, people with chronic diseases, people in low-income countries, workers who are working outdoors most of their time are those who will be at risk. Skin cancer. The incidence of this skin cancer, okay, will be, which is less common in developing countries, will be also exaggerated, and we'll see high number of skin cancer, melanoma. Why? Because of the high temperature. Why? Because of the high ultraviolet rays, and that will impact the skin directly. Now, what about natural disaster? When we have natural disaster, and natural disaster, floods, hurricanes, and each few months we heard about this in one spot on this earth. Is it only related to the mess we have, or it's merely related to the quick impacts, temporary impacts of this natural disaster, that people may be injured and died or harmed or be disabled? No, it's beyond this. Natural disasters have impacts beyond only the injuries, the falls and the death and the harm. We have release of chemicals, and those chemicals will have impacts, let's say directly or temporary, or at the point of when the natural disaster happened. And those chemicals also in the long run will cause lots of chronic diseases. So we have short-term and long-term impacts of these chemicals released in the air. Also, as we said, that the water will be contaminated, more infectious diseases, more diarrhea, okay? Not only this, when we have natural disaster, we are expecting that people will have displacement. They will leave their place and move to another place. Of course, they will go to a place which is not well built or have the enough infrastructure to protect them, to cover their basic needs. And this will make crowding. And this crowding also will make people or infectious disease easily transmitted among peoples, will also be correlated with social impact, will be correlated with mental impacts, okay, will be correlated with things related to the nutrition. So the natural disaster is not only that natural disaster happen, how many deaths happen. No. People who survive from natural disaster or from the deaths from natural disaster will be even worse in terms of health than those who suddenly die. Now, so if we go to figures now, globally, the number of reported weather-related natural disasters has been tripled since 1960. So before, okay, we had before natural disasters since long, but now every year we have natural disaster, and every year we have estimated, according to World Health Organization, 60,000 deaths because of natural disaster, and mainly in developing countries. And in 2017, the costliest year on record for natural disaster, unfortunately, that was in US and cost US $306 billion. So when we say how it will affect our health, it means that also this will be projected on the economic wise. How the government will contain this, how will contain those people who lost their houses, those people who will visit the health entities in order to get their medications because they will have high morbidity or chronic diseases that will be continuous till the end of their life. So all this are, at the end of the day, are the effects of climate change or natural disaster. And if we have here a comparison, we will find out that the hottest weather was in 2017. So only the hot weather, flood. Let's explore the flood and what happened when we have flooding. So when we have the change of rainfall patterns, this will also entail that above average rainfall also can affect our health. Of course, rains is good things. We need rain for the water supply, for agriculture. But when the rains became above the average, that also entails potential health impacts. So when we have heavy precipitation, that means we have extreme events in here. That means even though the vectors, the mosquito pattern in terms of increase, decrease, abundance, this will affect mainly the vector patterns. And also when we have floods, okay, when we have the river, the sea, that will be above over, let's say, the tops, this will affect, not only will affect, make it tsunami, like tsunami and affect people, no, it will also damage the crops, damage the agriculture, cause contamination, because what will happen, these floods will reach the supply of water or drinking water, and this will cause the contamination. And of course, beyond this and moreover, we will have natural disaster of the flood that will cause the injuries that will, on the long run, also because of damp happening because of these floods that will also continue for long, will affect the respiratory system. So let's stand here and see how natural disaster will affect our respiratory system. What is the things or the diseases correlated with these floods? So when we say floods, we always say floods, it's related only to the injuries happen. No, it's beyond this. It's beyond this. So, first of all, there is, according to study, everything is evidence-based. So there is a study conducted in Canada and linked the childhood, the children correlated, let's say, diseases or symptoms linked with the occurrence of the floods, like cough, wheeze, asthma, bronchitis, chest illness, and upper respiratory systems, and even eye irritation, and even non-respiratory system. Okay, so how the average of rainfall can affect our health? Let's see what will happen in terms of, now we don't have rain here. Here, the opposite scenario, and also it's extreme. Okay, drought. We don't have water now. What will happen? Okay, lack of water. That means we will have great impacts, big impacts on the loss on the agriculture, on the livestock, on the fishing stock, okay, on all the crops. And then what we will have, because of the lack of supply, we will have increase in the price of the food, and we will expect migration, dislocation. People have to leave their homes and be homeless or be dislocated to another areas, another countries, and they will be also at risk. So, of course, this ultimately will lead to more morbidity and more mortality and more burden of disease. Why? Because no water, no food, it means the nutrition will be impacted, and this is correlated, of course, with health issues. No water, dislocation, okay, mental health. It's not that easy. People, will change the pattern of their life. Okay, that also, you know that when we don't have water with the drought, this will be correlated with the transmittable diseases, transmitted diseases, let's say, especially by vectors. Transmitted diseases through the air or the dust, transmitted diseases through water, and of course, beside the injuries, health problems, the migration, the social, the weak infrastructure, we don't have access for healthcare services. All this entails. So you see how we can correlate. It's not merely about saying climate change impacting, but climate change, it's like a snowball. It affects something, and again, on its way, will affect, will have more consequences until the snowball will be so big. Forest fires, the one happened in Australia a few years ago. Okay. Of course, hotter weather, drier climate will be the reason for they correlated with the Australia's fires happened a few years ago. So when the forest fires happen, okay, it's only that we lose lots of trees in the forest. No, it also has short-term effects and long-term effects. On short term, we will have acute respiratory infections. Because of the direct, of course, those fires will release lots of toxic chemicals in the air, and that will be inhaled by people and then will affect directly the respiratory system and lead to acute respiratory infections, especially for those who have already chronic diseases, asthma and others. Okay, only this, the forest fires finished, vanished. Only this? No. Those chemicals will stay in the air and have also long-term effects for people. polycyclic aromatic hydrocarbon, and this will have the effect, carcinogenic effects for and stayed for many years in the long term. Now, what we have mentioned are related to the direct impacts. This is how our health is directly affected or impacted by climate change with the natural disaster and extreme weather. But indirectly, how we can be impacted indirectly. Let's see when the water, when the what happened to the environment because of climate change and how it will affect each system in our body. Let's start with the air pollution. With air pollution, you will have more carbon monoxide, more particulate matter, ozone, SO2, and nitrogen monoxide. We will have VOC or volatile organic compounds. We will have also lead, and this will directly impact. What will impact? Only our respiratory system and cause respiratory illness? No. It will even impact our nerve system. We will have nerve damage, always feel tired, fatigue, and have headache. And also it will cause skin irritation, nausea, and even cancer risk. And also it can affect our cardiovascular or cause cardiovascular diseases. So you see, when we have air pollution, it's not only air pollution, we inhale, okay, we are sick. No, it will affect the nerve system, cause cardiovascular diseases, respiratory diseases, and even though skin, affect our skin. Now, let's go to the water. When we have water pollution, directly this will go to our gastroenteritis, cause gastroenteritis, and affect our digestive system by bacteria, by parasites, or by chemicals itself. Now, when the soil is contaminated, okay, pesticides, and this also will affect our nerve system, cause headache, cause fatigue, and cause also the affect the skin irritation, nausea, and cause also the high risk of cancer. So you see, this is how indirectly will be impacted by these environmental changes. So high temperatures, levels of ozone are higher, more pollutants in the air. That will lead to cardiovascular diseases, respiratory diseases. This will trigger asthma for those who have it already. And asthma itself affects worldwide 300 million people. Imagine what those 300 million people will, how they will suffer by this, having these pollutants in the air. And also, according to studies, air pollution will be the cause of 1.2 million deaths every year. Okay, let's move to the waterborne diseases. Shigellosis, cholera, hepatitis A, typhoid fever, malaria, donkey fever, roundworm infections, campylobacter, giardias. All these are the waterborne diseases related diseases, okay? No, hepatitis A, which is related to the contaminated water or contaminated food, different from hepatitis B, of course. Okay, now the problem is, and this is what we have recently witnessed from the changing pattern of the influenza and those diseases or re-emerging diseases. Why we do have them? Because see, the transmission cycle of infectious diseases will be also impacted by climate change. Okay, we have some diseases transmitted directly from human to human, okay, or indirectly from human through vectors, okay, to human. But we have zoonotic diseases. What are those zoonotic diseases? Those are the diseases that usually found in animals but can be transmitted to human. And this is a disaster. And because the prognosis and the seriousity of this diseases will be a major threats. And many diseases like Ebola and even though COVID-19, even though MERS, all those were correlated to the source of animals actually. And climate change will exaggerate this, okay? So we are witnessing emerging and re-emerging of infectious disease. The pattern of epidemiology, incidence, and prevalence of diseases actually. 100 years back, let's say, in the during the World War I and World War II, we had many, or the world witnessed, and even though before that, witnessed lots of infectious diseases that were fatal and killed millions of people. Okay, but with the introduction of the vaccination or discovery of vaccination in 1950s, the world start gradually eradicate and tackle most of the infectious disease. And World Health Organization in 2000s celebrated the eradication of many infectious diseases because of the successful public health, let's say, public health policies and prevention or preventive measures, including vaccination, including sanitation, hygiene. All this protect people, population from having infectious disease. And the world start witnessing another thing, which is non-communicable diseases. And the main focus was about non-communicable diseases, chronic diseases, cardiovascular diseases, cancers, diabetes, and so on, because this is related to lifestyle. But unfortunately, since 2003, we start finding the re-emerging of infectious diseases with the outbreaks, epidemics, and recently we have pandemic. So SARS and MERS and donkey virus and the avian flu, swan flu, all this, and recently COVID-19. So this is the re-emerging of infectious diseases because it's types of influenza that changed in terms of the pattern among even though the change pattern, the vector of the vectors or of the change of the pattern of transmission from animals to humans. And by the way, avian flu, it's transmitted from birds to human. If avian flu transmitted from human to human, it will be a disaster, and it will be even worse in fatality rates than what we have witnessed with COVID-19. So, unfortunately, those are correlated with the climate change. And unfortunately, climate change touches human health. Why? When we have temperature This will reduce the time taken from vector populations to breed. So they will breed faster. When the temperature decreases, the incubation period of the pathogen also will be impacted. So we will have malaria parasite, donkey, yellow fever, and so on. So that means the vectors with the changing patterns of the temperature will become more infectious and faster infectious. Okay, so the behavior will change, and even though the population, the dislocation and whatever, this is a sort of changing in the social life. So this will increase the probability of the transmission. Okay, so it will also alter the bird migration. The birds also will migrate from place to place, and see the virus transmission cycle will also be impacted and directly affect the virus survival outside the host. Because the change, even though not only birds, the change even of the animals are coming from the forest, from the wildlife to live in cities. Okay, so all these problems and all this, I just exposed you and show you the wide list of health impacts of climate change, indirectly and directly. But can we do something? Can we start feeling responsibility of what is waiting for us if we keep witnessing what we are witnessing, and if we keep doing what we are doing without making any measures starting from individuals either to mitigate the impacts, the serious impacts. You can see the serious impact when we have natural disasters. It's from human activities. It's our responsibility. We are destroying our climate. We are destroying our earth resources, and code this. And of course, each natural disaster or weather extreme have led to lots of mortality, lots of morbidity, and even stay for the whole life in the long term. So we have to get started. Let's invest in new technology. Okay? Invest in new technology. When I say that, let's go to green. Let's use the natural energy. New technology, invest in solar panel and getting the energy from the sun. So invest in technology that help you to have clean air, clean planet. Okay, try to even use technologies to have more weather resistant crops. We have to take care of our water and always make sure this is infrastructure, this is the basic needs. People have the rights to get or to have access to clean water. So we need also to extremely support those who have the natural disaster in order at least to mitigate this direct impacts on them, especially when they are dislocated. Okay, so also poor countries with poor infrastructure should be also supported by safety, let's say, programs. So this is on the let's say nations levels, countries levels. But if we want to start for ourselves, okay, how we can save our environment? We can save our environments by changing the pattern of using energy around us, changing the pattern of our lifestyle, because your lifestyle will also impact the environment. When you choose to walk instead of driving your car, you are saving the climate. When you choose to take public transportation instead of car, you are saving them. When you choose to cycle, you are saving the climate. And not only this, the studies showed that even though the impacts at individual levels health on if you walk, how this will affect your health, you'll be protected from many diseases. And by the way, walking itself, the study showed that will decrease the probabilities of having diabetes by 40%. Let's say heart problems by 20%, breast cancer by 20%. So even though for mental health, it will be very useful. So when you choose to walk, okay, when you choose to cycle, that means you are protecting your health. So when you protect your health, what will happen? Also, you will decrease the burden on the health care facilities that you will have to have accessibility and health provided by health services. And that means this will be also a burden, a cost burden of healthcare facility. And you will save the environment because we'll have a clean water. We need to save the energy starting from our homes. We need to go to the clean energy, use the energy of wind, the energy of sun, the energy of water, because this is very safe and will support us by having clean environment, and ultimately will save our environment from those natural disasters and weather extremes that are human made. Okay, thank you so much for your listening.
Thank you, Dr. Zazla Fada, for the wonderful presentation. And in fact, we have lots of participants who have asked about the wonderful knowledge that you have been sharing. And thank you again. And before we go ahead, Dr. Jazla, I take a brief time from you to present a small presentation for our participants today from UniAthena, and for 3-4 minutes, and then we'll take on with the question and answers, which is there in the Q&A session. You can also have a look at the Q&A sessions, and then the questions are there. You can have a brief look at that meanwhile. So Dr. Jazla, can you please stop sharing this so that I can share a PPT from my side?
Okay.
Okay, thank you. Okay, this is for our participant. Hello, participants today from again for this session.
Okay. Yeah. So I have. Just I went through some questions. The difference between. Let me just start answering some of them.
Okay, Dr. Jazla, before we start the Q&A sessions, so I'll take 3-4 minutes, few minutes, so that I can show some UniAthena our PPT from our side to the participant. Then you can take a little bit of break for some time, and then we'll go for the Q&A session. Okay, Dr. Jazla.
So we will have 3.
All right. 2-3 minutes. I'll just take 2-3 minutes of yours. Okay. Hello. Good evening. Good afternoon. Good morning to all of you from wherever you have participant. So today I'm going to bring a brief overview about our learning programs in UniAthena. So you can have you can see on the slide. So our learning programs. So UniAthena is Athena Global Educations. We have more than 2 lakhs 25,000 of learners, and we have reached more than 212 countries. So our learning modules, our learning programs are associated with all the partners who are spread all over the world. They are UCAM, the Abatre University, the GMU from Italy, S2A, the Acacia University from Arizona, and Cambridge International Qualifications, accredited by Cambridge International Qualifications. We have chartered management institutions. We have Gurney American universities as partners. Our programs are spread into masters, MBA programs. We have doctorate programs also. And we have short courses for which I have shared the links in the group. So you can go
Sanjita,
through the link and
excuse me, Sanjita, the PPT is not yet seen. Please
okay.
share the screen once.
Okay. It's wrong, I guess. Oh, the thing is not responding from my side. Okay, Krishna Priya, this not responding from my side. I think it's got hanged.
Okay, I'll share with you. I'll present for you. I am sharing. I guess you can see my screen, Sanjita, you're there.
Recording. Okay, so is it viewable now,
Yeah, can you see my
Krishna
screen?
Priya? Yes.
Yeah, I'll move for you.
Okay.
Can let
Okay, so participants, welcome back again. I'm sorry that the PowerPoint was not visible that time. So I'm displaying the PowerPoint again for your convenience so that you can have a wonderful insight into our learning programs. So UniAthena, we offer you an affordable, flexible, accessible courses, MBA courses, and master's courses, doctorate courses. And also we offer you short courses. And we have learners all over the globe, many parts of the continent. And we are associated, you can see the partners who are here on the slides. We are associated with UCAM, Aberte University. We have University GMU from Italy. There is an accreditation qualification from you from Cambridge, from Chartered Management Institute. So these are the programs that we are offering, both academic programs and also the short courses, which you can learn for free. And you can visit our website for the same. We have masters, that is the master degree program. We have MBA is what we offer, and microcredit and also doctorate programs. And there are other short programs, diploma executive and MBA essentials and small basic short courses that we offer for your skill enhancement so that you will be able to enhance your knowledge and skill. All the programs that we offer are flexible. They can be flexibly according to you. Payment can be made. It is 100% online and it is self-paced. According to your convenience, you can progress ahead with the learning. And we have module course, which is free for you. And as soon as you get enrolled, there are many learning essentials and many contemporary knowledge insights you can have in the learning modules. We have personal tutors to facilitate for your learnings. And of course, we have accreditations from our global partners. So we have bite-sized delivery programs. The learning modules are all bite-sized delivery programs, and we have video learning programs also. We have content that is in the written part, and also we have rich e-library resources for you. We display here a small snapshot of what we deliver, the learning programs look like. We have 4 levels of learning programs. I mean to say, one is the video, one is the content part, one is the e-resource, and one is the additional resources, which will be good for you. That's the additional resources which you see. So check out all the learning programs in this website, that is www.uniathena.com. So thank you for participating. These are our India office, the UK office address, and also we have our office in Middle East, that is in Sharjah we have, and also in Dubai. So for admissions, for any queries that you have, you can connect to the admission@uniathena.com and also to the other email ID, which is shown to you, that is fatima@uni.com. So thank you, participants, for coming and joining this wonderful session. So we begin the question and answer sections now. And over to you, Dr. Jazla.
Yes.
We can check it in the Q&A sections here. There
Yeah,
are
I
many
went
questions.
through them. Yes.
Yes, you can go
Yes.
ahead, Dr. Jazla.
Yeah,
for
yeah.
me to,
Yeah, thank you so much for the questions. They are interesting, actually. See, I wish I had more time. I would like to explore more and go into details. I try to give you the main, let's say, correlated issue. However, let me elaborate on some questions, which is really very interesting, actually. Yeah, we have questions, Sanjita, for you. Okay, there are questions related to the program itself, but I will answer the questions that are related to the session. One question said, yes, one question was, what is the difference between global warming and climate change? This is very interesting. Whenever we are talking about global warming, okay, global warming usually is correlated with the rise of the temperature. And mainly it's the cause or caused by fossil fuels and the greenhouse gases that are released in the atmosphere. But when we talk about climate change, it's related to further, let's say, events of global warming, including, of course, rise of temperature, high temperature. So when I went to or started the presentation, I was talking about the weather extremes. Weather extremes, it means very high temperature or low temperature, and those hurricanes, tornadoes, all these are extremes. So precipitations cause flood, droughts, all these are correlated to climate change. So climate change is even, it's not only about global warming and rise of the Earth's temperature because of the greenhouses and the fossil fuels, which already also affect and impact our climate. So it includes more than this, more than warming or high temperature, because also one extremes are related to very cold weather. Yes, and we have some cold waves that people are dying. Okay, we have the level of the sea is becoming higher because we have also the melt of most of the snow in the spheres of the northern spheres of the Earth. Another question was also very nice, related, what is the relationship between climate change and mental health? I will tell you what. Climate change will directly impact our health by the happening of natural disaster. Okay, so natural disaster will be the direct impact of climate change. Can you expect what pressure will be on on people when they have natural disaster, when they have this flooding, when they lose their homes, when they lose their beloved ones? And this will, of course, cause traumatic. And we have the trauma after the disaster or trauma after these events. We have special discipline or special measure of treating people who get trauma after this natural disaster. So because people, they will keep recalling the scenario of how it's happened, how they are dislocated, how they have losses in, let's say, resources or material-based losses, and even human losses. And this, of course, will impact their mental health. And there are studies that after natural disaster, lots of mental health programs were very active, because they found out that people who are visiting and admitting to the hospitals because of mental health, those are not injured. I told you that not only natural disasters to cause injuries, it's caused also those who lived after and who lived with either chronic diseases or with mental health issues. Okay. Yes. Yeah, and also what kind of questions I can, what are the things that will, can we have some links regarding in the environmental impacts? Of course, environmental impact. When I say environment, what is environment? Environment is the physical environment, as we have physical environment and we have social environment. The physical environment or societal, let's say, is related to the air, to the water, the air we breathe, the water we drink, the soil. And if you remember the slides I show you, that of course all this weather extremes, drought will affect less water, will be correlated with the affect the agriculture, affect your nerve system, affect the supply of water, affect the nutrition, and this will be the consequences of the environmental. So the environment is water, air, and soil, and those definitely will be impacted by climate change. Okay, and those will be correlated directly and indirectly to make health consequences. Not only what biologists and economists are seriously concerned, but also health issues, of course. Now, how to mitigate it, as I told you, and I found very nice comments, not questions, very nice comments. I do appreciate, and I think that we have some people who are working in public health programs attending this session. Also, we have one comment that the countries with the greens, more greens, it means more trees. By the way, there was a program 1 month ago talking about, even though in hot countries, they try to measure the temperature in the places without the trees and in the places with the trees. In hot countries, they found out that there will be considerable degrees of the temperature in the places with the trees. Of course, because trees will release more oxygen. More oxygen will make your environment pure, and that will we now have healing or therapy with oxygen. So imagine how oxygen will support and how it will clean the water, how having green environment. So let's also focus on green. Let's participate in implanting trees, not in cutting trees, in implanting trees. So this is the way how we save our environment. We don't want to cut the trees in order to build and in order, no, save each inch of trees. And there is also a rule called 330-300. What is 330-300? 330-300 means that each person should see 3 trees from his window when he's at home. And also we need to have each 30, let's say 30 meter, we need to have a greens or trees. And also the closest park should be not more than 300 meters to be accessed by people. So imagine if we follow this rule, believe me, we will put ourselves on the first step from saving our environment. Go green. Go green not only to plant trees, go green in using the clean energy. Let's use the source. We have sun, we have wind, we have water. All this will be source of energy. And I'm so happy that, of course, the change of the pattern of our life, of the industry, will say this. So how to prevent the natural disaster from happening? As I told you, it will not be a magic wand. It needs lots of efforts, individual, community, governments, policies, regulations, all work together, and gradually we can save the environment by the means I have just mentioned. So it will be by the long run, of course, the global warming, the precipitation pattern, the pollutants, all this will cause the natural disaster because there is something wrong. You remember in COVID, when the lockdown happened to the earth, the earth, this is the, of course, the downside, it was disaster. We don't want to recall this time, but it was an experience for everyone in this planet to see that how we were destroying our planets by really the heavy using the transportation, the industry, the emission. So we can start working and we can gradually mitigate the weather extremes and natural disaster from happening. Okay, so about the technology, solar panels. Solar panels are now widely used and they are the easiest way. See, even though some countries are facing problem of electricity or whatever, so let's use the sun. The sun is good for our health, for vitamin D, and vitamin D will help us combat or defend or help our bodies from having not only chronic diseases and also supporting us to have resistance towards the pathogens, the infectious diseases. So this is one. It will be sterilizing. By the way, I will give you this piece of information also. If you put your clothes, your laundry under the sun, it will absorb the ultraviolet rays from the sun, and it will be kept in the clothes. And if you wear it, it will also help you to have vitamin D. So the sun will be sterilizing. The sun will give us energy. Use this simple technology that I can find it really some countries that have successful experience in this, and this is the first step. We can do it. Yes.
That was very wonderful contribution for the participants by your very much wonderful insight on the climate change. And we have lots and lots of interesting questions that have been coming by. And you did pick up some informative questions that would be very much insightful for our participants also.
Yeah, I would like to thank the participants also for these comments and questions.
Yes, there has been lots of questions thanking about the insights on the climate change and the health, and many questions are there. But we do need to come to an end about this wonderful sessions for today. And I thank you, Dr. Jazla, for coming here and being with us, being for the participants today, and giving such a wonderful thoughts on the environmental impact about health impact on and the environment changes. And we will continue to be in touch with you regarding enhanced programs on the same lines. Thank you so much, Dr. Jazla, for your contribution today. Thank you. And thank you, participants, for being here.
Thank you so much.
So,
and definitely I will see them in upcoming webinars, inshallah. Thank you so much and goodbye.